Good morning and welcome to the Greater Fort Lauderdale Alliance Business Leadership Town Hall Zoom meeting. This is our first for 2021 and we are pleased that you're joining us. I'm Sam Robin, Chair of the Greater Fort Lauderdale Alliance, and I'm pleased to be serving as your host today. Today, with so much happening in the past few weeks, we wanted to provide an update regarding the latest information about activities in Washington, D.C. and in Broward County, and to provide you with some update for medical information. Our purpose is to share as many facts as we can in this short amount of time, and our goal is to provide a clear and concise answers to questions that are particularly important to the members of our business community. To everybody attending, thank you for what you've been doing for the community, for your companies, and for your employees over the last several months during these very trying times. We have some great presenters today, and we will be taking questions throughout the meeting. If you have a question, please send it to us by way of chat, the button at the bottom of your Zoom meeting screen, and we'll answer as many as we can today. Again, just send us a chat and we'll take your questions there. And with that, let's get right into our meeting. With all that's going on in Washington over these last weeks, we're thrilled to have our first speaker with us, U.S. Congressman Ted Deutsch. Congressman Deutsch represents Florida's 22nd District, home to the communities in Northern Broward and Southeast Palm Beach County. He is now in his sixth term with Congress, where he's been serving as chairman of the House Ethics Committee and a senior member of the House Judiciary Committee and the House Foreign Affairs Committee, where he serves as the chair for the Middle East, North Africa, and International Terrorism subcommittees. Congressman Deutsch.
Thanks very much. It's great to be with you. I'm a little pressed for time given what's going on today in Washington, but let me first speak, if I may, a bit about last week's events in DC and then all the things that we're doing that I think can really be helpful in the community. I want to start with what happened. Well, actually, I want to start by recognizing Mayor Geller and congratulating him. Steve, it's always good to be with you. I want to start with what happened last week because the attack on the Capitol last week wasn't just a threat to U.S. Capitol Police and members of Congress and our staffs and support staff who works in that building. It was domestic terrorism, and we know that terrorism leaves a long shadow, and we're going to be dealing with this for a while. We're going to be dealing with it and coming up with solutions to prevent future attacks. We've had a number of briefings on that already in the past few days. We're going to be dealing with the fallout of this and what led up to it. We're going to be focusing on the incredible show of resiliency and patriotism from the Capitol Police and Congress and staffers that went back in the Capitol late at night to actually do our job and push back against the insurrectionists by doing our job and by certifying the outcome of the election. You've heard the story of Eugene Goodman. I think probably people have seen videos about what he did when he saw the Capitol Police officer who saw the crowd that pushed through the Capitol doors, the fact that they were nearing the Senate chamber, and he led these attackers on a different path away from those doors toward additional police back up. He's a hero. We lost Officer Sicknick. We lost, who was attacked and killed by the mob. We lost Officer Liebengood, who died by suicide just days after responding to the attack, an incredibly kind officer who was universally well liked. And so I'll just fast forward to where we are today. I don't want to sugarcoat this. There's a vote in a little later, just a bit from now, on impeaching the president. This, however anyone felt about the impeachment of Donald Trump the last time, this is bipartisan. We've seen strong statements from Democrats, Republicans, conservative commentators. All of us are focused on the same thing, which is accountability and protecting our democracy. I know people may have questions about that. If they want, I'm happy to answer them. But the whole goal here is for us to turn the page. There will be a new president next week, and we've got to protect our country. That's what's been driving everything that's happened since the attack on our Capitol last week. So let me get on to the things that we're all grappling with now, which is the COVID-19, the rising case counts, 1.5 million cases now in Florida. The 7-day average is now over 11,500, which is higher than the peak we saw last summer. 7,650 people are in Florida hospitals with COVID-19. The 7-day average for deaths is 140 compared to the peak last summer of 183. So the numbers are really concerning. We're at this moment where there is such hope. The vaccine offers such hope. Operation Warp Speed worked incredibly well in getting to the point where there are vaccines to roll out. The distribution, unfortunately, has faced really serious challenges, and allocations are made based on state population. The state then makes allocations to various distribution sites, and the Department of Health offices have some. Others are set up to administer the vaccines. I agree with the governor that we've got to be patient because supplies are limited and demand obviously far exceeds the doses that the state has received. And to that end, Senator Rubio and I and some others have urged a larger allocation to Florida, especially in light of the fact that there are so many snowbirds who are down here who meet the qualifications and are getting vaccinated here. I'm leading an effort among congressional members to encourage the governor to get DOH officials in every county the information they need so that we can closely coordinate with hospitals and health providers, elected officials, to ensure that our residents get the information they need. Broward County has worked really hard at this and has done a better job, I think, than a lot of other counties, and kudos to the mayor and others who are involved. But we need to give the county even more and better access to information so they can then provide that information to the residents here, and we can get these vaccines out. Let me just talk a bit about the business relief efforts, since I think that's what's on a lot of people's minds here. I know that we're eager to return to a fully open economy, and the way that we do that is to make everyone safe. And in the meantime, while we're waiting for the vaccine to be fully extended to everyone, we have to continue to wear masks and we have to continue to be safe. And again, just if I can acknowledge, since the mayor is on, as someone who's now flown several times, I think what's happening at the airport is a really good example of the steps that are taken to make sure that people are safe and remain safe. Vaccine protects people from serious illness after they've received both doses, and we just have to make sure that we follow the safety measures until then. In the meantime, we're working with the new administration, the transition, and then ultimately the new administration and the new Senate to move forward on additional relief legislation. But on December 27th, our spending bill included COVID-19 relief, $900 billion in new assistance. There's critical support for small businesses who continue to struggle in the current economic downturn as a result of the pandemic. There's a grant program to be administered by the Small Business Administration to help live venue operators and promoters, theatrical producers, museums. That's going to help the Broward Center. It's going to help the Museum of Discovery and Science and other cultural institutions in our area. That $15 billion can be used to cover the costs of payroll and leases, the purchase of PPE. We can provide much more information on that. The law also reopens the payroll protection program. PPP's already started accepting applications from businesses requesting a first draw. A second round of PPP funding will be available to businesses with less than 300 employees and revenue losses of at least 25%. In response to a lot of the comments that we got and correspondence that we received after the first round, the permitted use of funds has been expanded to include covering costs from purchasing PPE and other expenses, that ensure small businesses can comply with health and safety guidelines. It'll cover operational expenses, supplier costs, property damage caused by public disturbances. All of that is now included. In addition, PPPs being expanded to nonprofits, including 501c6s, destination marketing organizations, and housing cooperatives. All of that will also help because we realize that these organizations play critical roles in the community, and we want to make sure that they have access to the support. Congress simplified the process by which small businesses who received less than $150,000 in PPP loans can have those loans forgiven. There's now just a one-page certification of essential information. Again, we can get you more information on that. Small businesses can now apply for the emergency injury disaster loan, the EIDL loans. The new relief bill reopened that program with an additional $20 billion. There's a lot more that has to get done to, clearly there's a lot more that has to get done to help small businesses who are struggling. I'm disappointed that we weren't able to overcome White House opposition to including the Restaurants Act, which is bipartisan. It was a proposal that I supported and worked on that would have created a $120 billion fund to help revitalize the restaurant industry. I'm extremely disappointed, Mayor Geller, that the assistance for state and local governments was not included at the end of last year, and we're going to continue to push for those as we go forward into the new year. So there's a whole lot more there, and I just want to thank you for giving me the opportunity to join you this morning. We're going to be doing programming with the Small Business Administration. We'll be doing more to get information out to everyone. But I want to finish just really quickly with this observation. We've gotten to this point where there is so much optimism with the vaccine right there, but we've gotten to this point because people like you and your businesses and your employees have stepped up to help one another. You've looked out for your employees and your customers. We all have looked out for one another. It's that kind of effort that has helped us get through this thus far. There is a light at the end of the tunnel, and I just ask everyone to continue to be there as you have thus far to help us get through this as a community. And we will, and there are better days ahead, and I look forward to that. It's always great to be with you. Thanks so much.
Great, Congressman. Thank you. We do have a couple of questions from our group watching. One of the questions came, once President Biden takes the office, what do you anticipate will be the first orders of business and the longer term goals?
Well, there's no question that the very first order of business is everything we've been discussing. I mean, anything else that needs to get done will get done once, and will be done easier, frankly, once this pandemic is crushed. And that means getting vaccines out there. It means the first and second dose. It means making sure that people get the assistance they need to help get through these last, what hopefully will just be these last few months. So addressing COVID-19 is going to be of paramount importance. At the same time, we're going to be, and I appreciate the question because it's really relevant to everyone here. We're going to be the new administration will be looking at infrastructure investment, something that has always enjoyed bipartisan support. And in particular, the part of infrastructure that will also help us combat climate change. I invite all of you to reach out to our office with thoughts on this, but we've already started conversations with local government leaders about how to make our area, how to make Broward and the greater Fort Lauderdale area in particular, a focus of the new administration's infrastructure efforts. That we don't want to wait for something to pass and then try to access some of it for our community. We want, because we're on the front lines of battling climate change, and because there's bipartisan support throughout South Florida to do that, we want to be part of the discussions. I want administration officials to come to South Florida as we're preparing this infrastructure plan. And I would invite all of you to join me in that effort. I think it's going to be really critical.
Great. Congressman, we have just one more if you could.
Sure.
we've had, the audience has asked, can you address the business liability issue in relation to COVID?
Sure. The goal, well, the goal is to make sure first and foremost that businesses have everything they need to help keep, again, their employees and their customers safe. And there was a lot of attention. One of the reasons that there was no funding included in the bill at the end of the year was because Senator McConnell wanted blanket liability protection for businesses. I think by the time we have a new administration and we move forward, it's going to be dealt with, I think, differently. It won't be the broad, extended period that Mitch McConnell was talking about. I think there'll be some clear ties to the compliance that businesses have made with local ordinances. And the best example of that, I think, is down here in South Florida. A lot of your members have worked from the very beginning, have worked really hard to do everything they can to keep their businesses safe. Others have not. And we want to make sure that the people who have done things the right way, and this is the way the law should always work, but the people who have done things the right way are going to be protected, and that those who have flouted the regulations and have put people at risk won't have the same benefits, the same protections that the vast majority of businesses who have done things the right way will. So that's all going to get worked out. But it's not going to be this blanket multi-year issue the way that Mitch McConnell wanted to deal with it. It's going to be very focused and tailored to the challenges that businesses have faced during this pandemic.
Great. Thank you, Congressman. We appreciate your time today, and the audience, I'm sure, appreciates the answers to the questions, and we look forward to all the best for you in Congress this year.
Thanks so much. Thanks for having me, and we'll continue to post information and share it with the Alliance, and we'll look forward to hopefully getting together in person sometime really soon. So thanks so much.
Thank you. Our next speaker has many years of leadership at the local and state levels, and we're so pleased to have him with us here today. Welcome, if you would, Senator Steve Geller. He is our fiscal year for 2021 Broward County Mayor. Prior to his service as Broward County Commissioner, Mayor Geller was elected to the Florida legislature in 1988 at the age of 29. Mayor Geller has served in the Florida legislature for 20 years, 9 of those in the House and 11 of those in the Senate. Welcome, Mayor Geller.
Thank you, Sam. And it's always a pleasure to be here speaking to the Alliance. 3 things I wanted to say before I started. Number 1, Ted Deutsch and I served together in the Florida Senate. In fact, I was the Senate Democratic leader when he was elected. We're very fortunate to have Ted representing us. I believe he's going to be a real star in the United States Congress. Secondly, wear your damn masks. I've been very, very consistent in that message. Just please wear your masks. Third, there is no Broward County Health Department. It is the Florida Department of Health located in Broward County. So for those of the hundreds of people that wrote to me or left those nasty phone calls saying how the county was doing this wrong, the county was doing that wrong, it's the Florida Department of Health in Broward. Actually, Broward County doesn't have the website or is not running these things. So having said all of that, I have to tell you that I believe that the vaccine administration in Broward County, despite what a lot of people think, is actually running much better than in other counties and as well as could be expected. Remember, the governor changed the CDC guidelines to change it to give priority to people over 65. I happen to agree with that, but this was done with obviously no notice, because you can't give notice and then say we're going to start it. Once he said you're going to give priority to people over 65, all of the seniors began calling immediately, thinking that the governor had said, well, I have priority so I can be vaccinated right now. As of last Monday, 10 days ago, which was the last time I checked, there was enough vaccine in the state of Florida, enough doses of vaccine to give 2 shots to 568,000 people. There are 20 million people in the state of Florida. 4.5 million are seniors, and the healthcare providers were the first ones to get the shots. So there simply was not enough vaccine to give everybody a shot immediately. Broward County has about 340,000 seniors, and I would say 300,000 of them will want the shot. And I think all 300,000 of them wanted to get the shot in the first week. And the problem was not how it's being run, it was merely unreasonable expectations. And right now, the state of Florida has set up 10 sites. I think it's, yes, 10 sites throughout the county, including Broward County has been assisting with county parks. Additionally, the new one that has just been set up this week, actually, I think yesterday, was at Lockhart Stadium, and that's being co-run by Broward Health. But we have the Tradewinds Park, Markham Park, Central Broward Regional Park, Vista View Park, Holiday Park, Coral Square Mall, the Sunrise Lakes. And in addition to that, they are setting up, or the Florida Department of Health has set up, Florida Department of Emergency Management has set up senior pods at Winmore and Coconut Creek, Kings Point Tamarack, Century Village, Deerfield Beach, and Century Village, Pembroke Pines. In addition, some of the hospitals have been giving vaccines. So the vaccines are getting out very quickly in Broward. You have not seen in Broward seniors waiting overnight in their cars like you have seen in other counties, where the counties or the hospitals decided they would do it on a first come, first served basis. I think the concept of getting an appointment is much better. And the problem is the seniors that are trying to call are all saying if the website is broken. It's not broken, it's full. When they've been calling Memorial Hospital and they're saying, well, the phone lines are broken. No, they're full. It's going to take another, each site can do about 500 per day. They're each open, new people, because that means they can give 500 to new and 500 for the second shot. So each site will be open for 500 a day. 10 sites is 2,500 a day. 5,000 a day times 5 days a week. So it's going to be 25,000 plus the hospitals, plus Department of Emergency Management. I think we'll put out 40,000 shots a week. And then it's simple math. If there's 300,000 in seniors in Broward, and we're able to do 40,000 a week, it's probably another 6-7 weeks to finish the seniors. After that, we'll be proceeding on to others. So that's, again, I believe it's been running pretty well in Broward. And for the people that think that they could all be vaccinated in the first week, it's just an unreasonable expectation. Let me move on to what we're doing. Again, I have been extremely clear and consistent. Please wear your masks. They are not political statements. They are medical devices. I have received yesterday, my staff was laughing because they showed me a thank you card, and when I opened it, it was thank you for being, and then I cannot repeat the remainder of the language. But it was decided that I mean, they were calling me a socialist because I want people to wear masks. I do not understand the government relationship between being a socialist and wearing a mask, but maybe in their warped mind they thought it was. But I have also been a strong advocate for requiring businesses to enforce the mask orders. It is my opinion, I have been very clear, I don't want to shut down businesses. If we're going to avoid shutting down businesses, then we have to enforce wearing of masks to protect the public. So people who say that they are opposed to mandating mask wearing and opposed to shutting down business, I think have conflicting positions. I'll leave it up to Monica to tell you about the current state of what our numbers are in Broward, where they're heading, and things of that nature. I don't know how much time I have left. Let me say two other quick things and then I'll be done. Number one, there was a discussion at the beginning of yesterday's county commission meeting where we mentioned people who have passed since the last meeting. And several commissioners talked about people that had passed away from COVID, including one that was in his 40s. So, the average person that is getting COVID in Broward County today is 39 years old. So please, I'm begging you, wear your masks. And then the last thing I was going to discuss is, remember, we are not setting up the priority for who is getting the vaccines. That is being governed under the emergency order of Governor DeSantis. There was a debate at yesterday's commission meeting as to whether or not we should write a letter to Governor DeSantis asking him to follow the CDC guidelines. The vote was actually 6-2. I was on the losing side saying no. And it's a simple question. Should we protect first the most vulnerable people, including seniors? That was the position I took. The other equally valid position is the first people that should be protected are not the most vulnerable, but rather the people most likely to come in contact with other people, such as grocery store clerks, food workers, postmen, etc. Both of those are equally valid positions. I personally advocated for protecting the most vulnerable first, but I could easily have taken the other position. So there's a lot more that I could say, but I believe I've already exceeded my time, so I'll be happy to answer any questions if there is any time left for them.
Thank you, Mayor Geller. Yes, we do have questions from our audience. One of the main ones is, are there any resources that we can help get the word out on?
Are there any resources that you can get the word out on? Probably, I don't know what you mean by, are there any resources that you can get the word out on? If there's anything I'd like you to get the word out on, it's please wear your mask. Businesses, please enforce the mask law. And also we are looking for additional volunteers that are able to administer vaccines. We have two bottlenecks here. One is the number of vaccines. We're limited by the number of vaccines that we have. We're going to have, I think it's going to be very tough to keep up with the 40,000 people a day, which is 80,000 shots, but I'm hoping we'll be getting 80,000 vaccines. Right now, there aren't enough in the state to keep up with our demand, but the state keeps hoping they'll be getting more. So one of the bottlenecks is the vaccine. The other is the amount of people we have to give the vaccinations. Every nurse in the country has been hired by somebody. So what we are now looking for are people that have recently retired that were paramedics, EMTs, physicians, nurses, pharmacists, or anybody else who can give vaccinations, because the remaining bottleneck is we simply don't have enough people to give the vaccinations.
Great. Mayor Geller, thank you very much for your time with us today. You answered a number of the questions from the audience before we could even pose them to you. So very informative, and we really appreciate your time, and we thank you.
Always a pleasure. Good to see you all. Bye-bye.
Great. Our next speaker this morning is Monica Osepro, a 12-year veteran as a top Broward administrator and now Broward County's deputy administrator. Monica is going to give us an update on some of the latest information from Broward County administration. Monica?
Thank you. Good morning. I want to echo a few of the remarks that our mayor shared with you all. And first is, we do have a very close partnership with the Department of Health here in Broward. And I know it's important that he makes that distinction that we are not one and the same, but we do work very closely with them and support them. All of this endeavor from the beginning of COVID, from the very first day. I remember receiving that first phone call. So we've had a very close partnership. So I wanted to reiterate a few things and expand upon some of the information he provided about the vaccination sites. That is something that is of great importance to us. As he mentioned, there's kind of a supply chain issue that we first need to, get a better understanding of how that's going to flow down. And that's one of the things we don't know is how there may be some change at the federal level of how resources would flow down. So vaccinations and additional financial resources and how that might look, both from the federal and state level. So I will say that we've been analyzing how we might be able to better assist the Department of Health with the vaccination issue. And in fact, we have some more phone calls this afternoon with them because we've identified that we may have some possible excess capacity. And what I mean by that is, we assist the Department of Health by offering many of our parks for these sites and some county facilities. And right now we're operating one shift. So what we're looking at as, and I noticed one of the questions in the comment section here was about why can't we do 24/7 operations? And ironically, that's exactly one of the things that we're looking at, not necessarily, maybe not 24 hours, but definitely 2 shifts so that we expand the hours. But what that requires is additional resources as well, as far as personnel, not just dollars, but, you have to include, the setup, the security, the folks that would administer the vaccines, and of course, having the vaccine. That is obviously the first and most important issue, is that we would be able to have enough vaccine to handle that, to implement that. But we have identified some funding that we could use for a 6-month plan, both for our current operations that we have, as well as expanding that to increase the throughput that I've just described. The county administrator and we will be presenting that to the commission probably within the next week or so, a plan on how to do that, and with their blessing on the allocation of resources, that's hopefully what we would proceed with. So I think that's some good news, and we're certainly thinking outside of the box on how best we can assist and provide support to the Department of Health in that regard. Another point that I'd like to really stress is our partnership with the business community. Always that's an important thing to us is to work with the business community and to those most affected. And really, as you've all noticed and seen, and I think I've spoken to many that are on this call already through other venues, that we have done, I think, a great job in not shutting down the business in the restaurant community, for example, where other counties have done so. We did not close down in-person dining when others did. And we were able to do that because we had the commitment and working with the business community so that they can help us with enforcement efforts. That's something that we still are asking for partnerships and better enforcement out there. That will also go to the question I saw in the column section about the dog parks and the masks. So, that's another thing. So if it's it depends if that park was a municipal park. So, that would be pretty much the jurisdiction of the municipality. However, our county orders stand. And what that requires is if you're outside and you're not able to be within 6 foot of social distancing from another individual outside of your household, that you do have a mask on while you're just passive, either sitting or with your dog, for example. So that would be a requirement, and the existing orders require you to have a mask on. So, I would encourage our municipal partners to assist in that, and you can call, an individual can actually call 311 and report a violation, and then we would also be in contact with those municipalities to let them know. But there is something that you can do. So in response to those questions, the last piece I really want to talk about was the importance of testing sites. So we're all focused on vaccinations, but the county is also still committed, and we realize that the importance of this is also to test and to continue to provide opportunities for testing. So on our website, we have a number of resources that I can make sure that Sam, you can send out to the group afterwards with the website /coronavirus / either collection sites or vaccination sites. So we could get that out to you so you can see where the vaccination sites that are operating and where the testing sites that are operating are. That does not include any private testing or vaccination that is done at the hospitals, but these would be the county and the health department sites. I think that's probably my time allotment, but I wanted to make sure I hit on those issues and also address some of these questions I saw. So with that, Sam, I'll kick it back to you.
Thank you. That's great. We had just one additional question. Are there any business assistance programs that the county's currently has underway or that companies should know about that's forthcoming?
So, yeah, so we have our small business assistance programs that we have been, our grant programs that are out there. I will also make sure you guys all have that information that you can send out electronically to the entire membership, that I think will be helpful. Our director, Sandy Michael McDonald, has been working hand in hand, I know, with Bob and others out in the community to make sure that we're pushing that information out, and I will make sure that you have everything pertinent so the membership has all of that.
Fantastic. Thank you for your time, Deputy Administrator. We really appreciate all the answers. The questions came in. You already had on the tip of your tongue what we needed to know, and so we thank you for giving us a great update. We really know where the county is. So thank you very much for attending today.
My pleasure, and thank you. And you'll have to excuse me, I do have another Zoom I need to jump off to, but I appreciate being asked to share our information as well. Thank you so much, Sam, and the rest of you.
Great, thank you. Yeah. So our final speaker today will provide the latest information for health regarding the vaccines and also a hospital update, something of course interesting to all of us. We're very pleased to have with us today and welcome the Executive Vice President and Chief Operating Officer of one of the largest public health systems in the country, Broward Health, and Alan Goldsmith. Welcome, Alan.
Thank you, Sam. I appreciate the opportunity to speak to the Alliance. When I was putting this agenda together, I really wanted to talk about access to care, and I'm going to break that down into really 3 bullet points. Number 1, testing. The number 2 is going to be current hospitalizations and where we're at with COVID within the community. And then finally, the topic that everyone wants to hear about is vaccines. So with regards to testing, Broward Health, through this journey for almost a year now, has set up 4 mobile testing sites. We've included a site for the homeless to be able to test the homeless. And then we've also tested over 90,000 people between our hospitals and within the community. So we are going to continue with our 2 sites as of right now. And we feel that that's an important part, as well as the vaccine, to continue to stop the spread of COVID. The second one is current hospitalization. So this one I'm watching on a daily basis, and I saw a lot of questions of, can we just open up 24/7? Hospitalizations, although the vaccine is front facing right now, hospitalizations are increasing, but I do want to put a little caveat that too. They're still 42% down from the peak in July. And so we are able to, on a day-to-day basis, hold the line and be able to staff up to the bed capacity. But I just wanted to point out there is just one difference from July to now. Is in July, if you guys remember, we were really a hot topic. We really had a big spike, and we were really the only state that had a COVID spike. So we were able to draw down some traveler nurses from states that really were not that busy, and they were able to really staff up our hospitals. If you fast forward to today, there's really, because of the holidays and everything, there's really spikes all over the country. So we're really struggling to get staffing in here from a traveler perspective. One thing that has helped us is, and I know we talked about it earlier, that our healthcare workers were in the first batch of people to get the vaccines. So we're hoping that now that they have the vaccines, they're not going to be able to go out on a COVID-related, sickness and be on FMLA until they get better. So we're holding the line. I just, I always want to talk about the staff and the healthcare heroes and the nurses and the respiratory therapists and the EVS techs that really come together on a daily basis to make sure that we're providing care for our patients and making sure that the hospitals are safe and people can come to the hospitals. I do want to say to everybody on this call that cancer diagnoses are down 30% year over year, and we haven't cured cancer. So, remember, tell everybody you need to go to your primary care. You got to wear a mask and you got to do your health care. And we need to continue with that moving forward. Now I want to talk about the vaccines. It is it's hope, right? I know I heard everybody else talking. Vaccines are hope, and we need to always remember that these are hope, and this is what's going to get us out of COVID-19. It is a logistical challenge. It's something. It is a challenge, but it's nothing that this country and this county and everybody we can't get through. Just to walk you through it, there is 2 right now vaccines that are in use. There's the Pfizer vaccine, which is they call it the Pfizer 5, and then there's the Moderna. The Pfizer was approved a month ago, and the Moderna was 3 weeks, a week after that. The Pfizer presents challenges because it needs to be frozen at a negative 62 below zero. Once it's thawed out, you get 5 in one vial. You get 5 doses, sometimes 6, based off of if the pharmacist can pull it out. And it needs to be put in an arm within 6 hours. And you get your first dose, and then 3 weeks later, you will get your second dose. The Moderna virus, the Moderna vaccine does not need to be stored at below 60 something degrees, but it can be stored at a normal temperature. And that is a little easier from non people that have the freezer. So the Walmart, I know if you saw the governor is going into Publix and CVS and Walmart, the Moderna vaccine is going to go there because they don't have the freezer storages to take on the Pfizer. So the Moderna is a little easier to handle. It's and that's a 4 week. So you get your first dose, and then you get your second dose you get the booster shot 4 weeks later. So that's really kind of an overview of the vaccines. They're the same technology. You cannot get a Moderna and then get a Pfizer shot. So that is something when you look at all these sites that are up, logistically, you need to make sure that one's a Pfizer site and one's a Moderna site. So there is an added layer of logistics that we have to account for. We have vaccinated 4,000 of our employees, and 1,000 of them just received the second dose. So that's about 40% of our workforce. And it was one of the best days that we had at Broward Health. People were crying, and it was hope. So we were excited about that. So at Broward Health, what Mayor Geller said earlier, we opened up Lockhart Stadium yesterday. That site, it was a soft launch. It could take 500 vaccines right now. We can get that site up to, with vaccines and with staffing, up to probably about 1,500 a day once we get all the resources in there. We built it for the long haul. We didn't build it for you a week or two pop up. We built it for an anchor site for Broward County, where we can vaccinate a large portion of our county. So that is up. We launched yesterday. In our web, it's a web registration. We had 38,000 requests in less than 12 hours, and I'm just being told by my people we now have 50,000 requests. Obviously, we don't have enough supply. We are going to be calling people in the order that they put in their registration, and we will continue just to work off of that list to vaccinate as many people as possible. And really, that's kind of an overview. I know that if there's any specific questions, I would love to answer. Go ahead, Sam. Is there any questions?
Well, I think you've given us great insight and really good information on the differences on the vaccines and how Broward Health is handling it in the county. Can you tell us any measures that are being taken to ensure that no waste has happened with any of the vaccines?
Yeah, so that's a great question. I refuse to have one vaccine wasted. So, we have what we're doing is if there's like a no-show, right, or there's an extra we will ask the staff if they have not got vaccinated. Then we'll ask the staff to call their family members of over 65. And then we'll just go down to our list of the 50,000 people we have, and we'll say, look, can you get, we'll keep the site open if we need to get the vaccine in arms. We have not had one waste dose since we started. We will not have one waste dose.
That's fantastic. Can you tell us from our side, from the business community, what can we do to help support what you're doing?
From your side, we got it, and we just need you guys to continue to press that everybody wears masks. We need you to be an advocate in the community and tell people to be patient, that everybody is working to get a vaccine in an arm, that we understand the importance of it, and to just continue to be safe and wear a mask until you can get the vaccine, or even after the vaccine, until we're out of this public health crisis.
So we've had another question come in of which vaccines are you using at the stadiums and the parks?
So at the Lockhart Stadium right now, we're using Pfizer, and then we do have some Moderna. And as we get a more steady supply, we plan on opening up some additional sites for Moderna. I'm trying to keep the Moderna and the Pfizer sites separate. It just adds on an additional layer of complexity when you have two different vaccines going in. And our job is to really make sure that we administer the first and the second doses of the same vaccine.
Sure. And that's a little bit of what our next question was, of how are you managing those schedules to ensure that all of the doses are used?
So can you repeat that question, Sam?
It was, how are you managing the schedule to ensure that all of the doses are getting used that you have?
Okay, so we work with the state. We get a weekly, the federal government releases the vaccine to the state. We tell the state that, based off, now that we have this anchor site up and we know how many we have, we could say we need X amount of supply to be able to feed the first and the second dose. And that's how we're really managing it. We're just, we're looking at our supply, and then we're making appointments. If we have any additional doses, we're adding on to our schedule.
Fantastic. Alan, thank you very much for joining us today. Your insight is invaluable to us. It's great for us to hear what's happening on the inside with the vaccines, and you answer a lot of our questions, and we certainly really appreciate your time.
No. Can I just say one other thing, Sam?
Absolutely.
Just guys, we're almost there. We need to be very diligent with wearing masks, and we can't put our guard down. We need to continue to do what we're doing. And I'm hoping that in 6 months, 8 months, we could be having a different kind of town hall and be talking about, being, a great 4th of July celebration. So just keep up the good work, everybody. And know that Broward Health is here to support the community and do everything that we can to get the vaccines in people. So thank you very much for having me.
Wow, that's fantastic. Thank you, Alan. Now it's almost our time to wrap up. I'd like to thank each of our presenters today. Your insight and guidance has been extremely helpful. And thank you to each of you for what you're doing for the community and through these continuing challenging times. To close, I'd like to swing over to Bob Swindell. He's the president and CEO of the Greater Fort Lauderdale Alliance. And Bob, thank you. Take it away.
Thank you very much, Sam. And I just want to repeat Sam's thank you. We appreciate Monica, Congressman Deutsch, and Alan, you being a part of today's update to the business community. Again, as we've done when COVID first became an issue in early March, we started putting together these town halls to get the most relevant, up-to-date information to the business community and give you an opportunity to hear directly from the people that are knowledgeable about the COVID virus and then also the vaccine. I would just close with a couple of things, and I am by no means an expert, but I've been taking some notes and jotting down the numbers. And first of all, Mayor Geller really, he led with, please wear your mask. We've got to reinforce that right now our positivity rate is a little over 10% in Broward, and that's about what we're seeing at the state level as well. That's way above where we want to be as a community. As Monica said, the last thing the county wants to do is create more restrictions on business. We need to be going the opposite way and allowing businesses to grow their customer base and begin taking care of more people, but we got to do it safely. So wearing the mask and following the protocols, keeping social distance, physical distance, those basic things are still critically important. We're all excited about the vaccine, but we've got to maintain the safety standards for the next few months while the vaccines are being, while people are receiving the vaccines. If you think about it by the numbers, what I'm told is 60% of our population, if they're either vaccinated or experience the virus, that'll create what they call a herd immunity. So we have a bulk of our population. So at 2 million people, that's about 1.2 million people in Broward either inoculated or have gone through the virus and have the antibodies in their system. That's 2.5 million shots. So if you think about 1.2 million people getting 2 shots to have the virus securely, the vaccine securely in their system, the numbers, Mayor Geller talked about 40,000 a day. I think right now there's about 10 sites in Broward. Anywhere from 1,000 to 3,000 shots a day is optimal for those different sites. But if you think about it, if we can get up to the point where we hit 40,000 vaccinations a day, I mean, we can have, herd immunity for Broward County within 60 days. So the critical part of this is obviously the supply chain. And I know that Governor DeSantis is working with the federal government on, opening up those channels and having more vaccine coming into Florida and obviously coming into the urban areas. It was a huge compliment to Broward County that Broward was one of the first counties the governor chose to start up the vaccination process. And a lot of that was because he had confidence in our Broward County government and their ability to get things done. Shane Strum, the governor's chief of staff, is a Broward, hails from Broward County, and he keeps an eye on this county. But between Jared Moskowitz and Shane Strum, we have 2 world-class, leaders and administrators on the governor's team that keep an eye on things in Broward County for us. So, I think as our teams ramp up, great questions about, extending to 2 shifts. I think is we've got the sites, and I think public stores are now going to be offering vaccinations, and they can do about 100 to 125 a day. Again, if we can get to that magic number of 40,000 vaccinations a day, we can within 2 to 3 months have a large segment of the Broward population inoculated for the virus, and that's where we want to get to. So again, thanks to all of our speakers. Sam, great job. You had big pumps to fill, and Juliet Rorlak, because she did an amazing job for the past year and being our facilitator for these town halls. You did a great job today, Sam, and my thanks to everyone for taking time out. Enjoy the rest of the week, and I hope everyone has a good rest of the day.